I'm Dr. Joshua Moll from Louisville, Kentucky. I am a chiropractor, and my practice is actually in New Albany, Indiana, so just across the bridge. But I live in Kentucky. So I've been in practice for 6 years, and I treat everything from kids to pregnant ladies to families and seniors. So kind of the whole gamut. I work at a multidiscipline clinic. So we have a physical therapist on staff. We have a number of different modalities from laser treatment to acoustic shockwave and traction. So it allows us to offer a number of different holistic options to our patients, which is really neat. So physical therapist and chiros work really great together. And some of the things overlap from a standpoint that we were evaluating the body from a biomechanics standpoint, posture correction. And we have a great physical therapist on staff that I work well with. And he focuses more on a lot of the stretches and strengthening of muscles, left to right and front to back. And again, there's many things that we both can do. It's just that's more his specialty. And I do the actual manipulations, the adjustments, the alignments. So that's, I guess, the primary difference. We both really look at the body as a whole instead of parts, and try to go from a conservative standpoint forward with them. And really a big part of what we both do is teach the patient how to be healthy and teach the patient how to take care of themselves from a movement standpoint.
Yeah. I think that is an important aspect too. Looking at like doctors, physical therapists, even like personal trainers, chiropractors, personal trainers, anybody who works with people about their body, or a nutritionist, whatever. I think just educating them and showing them how like they can help themselves as well, instead of like making it something to where, okay, you have to keep coming back to me forever, and that kind of cycle of things. I think it's really cool to hear you kind of say like, this is what we help teach people. I think it takes it to another level when you do that.
Well, 100%. Healthcare is self-care, and we're seeing more and more we have to take control of our own healthcare, of our own health. So that's one of the things we try to do, is empower our patients to be able to do that.
Definitely. So how'd you get into this kind of work?
It kind of, I guess, chose me. So I grew up playing ball. 3-sport athlete, was fortunate enough to get a full ride to play football at Eastern Illinois between the years of Tony Romo and Jimmy Garoppolo. And that's actually where I had a career-ending injury in the weight room. Long story short, it took away the better part of my 20s. So for years I was in excruciating back pain, couldn't sit through a movie without having to stand in the hallway because it hurt to sit, couldn't sit through class without having to stand in the back with a clipboard. So I ended up having to get back surgery in my 20s. I'm one of the few chiros that have had back surgery. And there's a time and place for everything. And I'm thankful I was able to get the surgery, because it did take away the searing leg pain, but I still had back pain after it. So I thought, well, maybe I'll go see one of those crazy chiropractors. And it gave me my life back. So I thought if I could in any way help people with the similar things of what I dealt with, it would make all the difference. And so that's what I did. And I'm passionate about what I do, because I think I can connect with my patients in many ways, from dealing with a similar issue. I've also had 2 knee surgeries and 2 shoulder surgeries just from playing ball and playing hard. And so again, I know that path to healing. And I had the back surgery and woke up and still had back pain. So I had to turn to a holistic option. And so again, I have a strong roots with chiropractic.
Obviously, you probably have that passion, but do you feel like your background in sports as well is something that you take into, the field on a daily basis and think, this is kind of what I experienced? And when somebody comes to you with that kind of similar sports background, you kind of have a little bit of that insider information a little bit?
Oh yeah, totally. I think, what I do is physical, and so I have to draw from, being an athlete before and still being an athlete now, except for on the field, it's, in the clinic. But also understanding, many of the people that I treat are athletes. I was the chiro for the Kentucky Muscle for a few years before COVID. So that I learned a lot there from seeing the bodybuilders and how those athletes were different than the CrossFit athletes, and how those athletes were different than the the Olympic powerlifting athletes. And then we even had the arm wrestlers there, which was really neat. Again, all just different forms of athletes, and they all have a spine and biomechanical hiccups. And the more that we can get the body aligned and moving the way it should, the more they can perform at peak performance. And so sometimes it's putting a person back together after they slip in the ice, but other times it's just optimizing that peak performance. So, that's why you see guys like Aaron Rodgers and Federer get, regular chiropractic treatment.
It has this kind of thing around it. I'm sure you're very aware of it being in the field, but there's probably, a very large group of people who love it and support it. And then there's another group where it's like, don't go to them. They're, just gypsy doctors and, all this other stuff. How do you try to like counter that? I mean, or do you just kind of let it sort itself out a little bit?
Well, everyone's going to have their own opinion. And just like many people with, people that exercise in the gym, they say, oh, that's not for me. And they discount everyone that lifts weights as meatheads or, just not their thing. And that's really obviously not the case. And chiropractic has come a long way, especially in the last 20 to 25 years from a research standpoint. And that's why there's a chiropractor on every NFL sideline, on most every NBA court. So since that's happened, I don't get as much of it. But, chiropractic isn't for everybody. But it is something that I think can help the vast majority of people. Most people at some point in their life are going to have some back issue and some some sort of neck pain. And that's something that's our bread and butter. We do help with many, many more things, but just from an entry level standpoint, it helps with the opioid epidemic. It helps with keeping the hospitals not so full. So it's one of the things that we can do to really help alleviate on a front level portal of entry care.
Just from like a daily use, a person maybe who isn't the most active, but just somebody who has some back pain, neck pain, what is that mostly contributed to, at least from what you see? Is it posture? Is it sitting a lot? Is it how you sleep? Like what kind of things do you see as the main causes?
So, I get asked that a lot, and everybody wishes there was just one problem that we had to worry about, but many times it's a combination of things, kind of that perfect storm. So, I'm a big believer in doing all the little things. So, and that's, hydration, the more hydrated or less hydrated our muscles are, our spine, our disc in our back are, that can really sway things one way or another. Physical exercise is another thing. So I'm a big believer in all the little things. Posture is huge, especially asymmetry within posture is one of the main things chiropractors look for. So whether that's you're always crossing your left leg over your right leg, you're always kicking one hip out and standing on one side, or even from a work standpoint, if you're always twisting, going one direction, you could be creating a postural asymmetry from a flexibility standpoint or a strength standpoint. And then you just multiply that over time. And that's one of the things that really can create problems within the spine, which means you're going to have pressure on a nerve and you're going to have dysfunction within the body.
And as far as like, the spine, I guess from an anatomical perspective, it's kind of, the middle of the body, it's maybe a little bit higher than low, but like, do you see that a lot of issues are top down or bottom up issues?
That's a good question. The way the spine works, in many ways, it's like a building, and you got to have a level foundation, right? And if there can be problems upstream from that, if the foundation is not level. But the other thing is the brain is the master controller, and it speaks to the body through the nervous system, where the spinal cord and the nerve roots, like an electrical system. And the very top bone in the neck, the Atlas C1, is, many call it the reset button, the circuit switch. So, the brain stem itself comes down to about C3. So there's a lot of neurology up in the upper cervical region. And so from that standpoint, it would be above down. Definitely inside out. Many people, I think, in this day and age, believe that healing and health come from outside in, taking a pill, when really health comes from the inside out. Doing movement, staying healthy in the gym, but from the inside out. So you get a cut on your finger, you can put Neosporin on it to help it heal, but the body's going to heal itself from the inside out. So you just have to optimize the conditions.
You know, you talked about that neurology and all that. It's very intimidating from the perspective of, if you don't know, if somebody like me who doesn't really know that much about it, you get an injury, or you're thinking, is this going to cause an injury? And all that's, it's so important, just a basic human function. And how is that, as you start off in the field, how did you feel any of that intimidation, working with a person in kind of the most vulnerable position possible?
So they start you off, there's this tiered step system from doing that, learning the actual adjustment. And that's, a development part with a touch with your hands, where, because we're reading with our hands, we're reading the spine with our hands, taking input in, but also delivering the adjustment with our hands. So there's a learning curve to that. And at the beginning in school, and, anyone that's been through it, knows that we laugh about it when we were in school, because you definitely are nervous. But it's something you get just so much more comfortable. It becomes like, honestly, it's like riding a bike. And I'm sure it's the same way with all the other professions, whether you're, driving a forklift or, like you doing interviews and, working the podcast game, you get so much more comfortable. It becomes just second nature.
And when you're in there, like I said, I've never been, so, I'm just used to hearing what people have to say, a lot of horror stories you hear about and on TV and movies. Is it really that moment of like the pop or the whatever that kind of like is, you mentioned the reset. Is there that one moment of like reset when somebody does have the like moment within their body, or is it over time?
Oh yeah, no, they feel it right away. They definitely feel it right away. And that's why, and all chiros are different, but from the ones that I know, as well as myself, we do a thorough examination, take x-rays, make sure we know what we're dealing with on the inside. And when the adjustment's given, there's a number of different techniques. The fun ones from a standpoint of noise, is only one of the many different techniques. They don't all create a noise. They don't all, there's even, some you can do with an instrument, a very gentle, precise adjustment with just a click of an instrument. So there's really a spectrum on it there. And one of the things I tell people is, there is an inherent risk in any form of healthcare, from taking an aspirin to getting breast augmentation surgery to, of course, anything else, the whole spectrum. But you got to look at the numbers, and that's what I do. And so if I were to get into a bunch of car accidents, my monthly premium for car insurance would be expensive, right? Well, similarly, we have to carry malpractice in case something were to happen. And as a chiropractor, that costs us annually $1,200 to $1,500 a year. For an MD, it's going to cost them around $15,000 a year, up to $50,000 depending the state. So just from how the insurance companies see us as a risk, it's obviously not near as dangerous. And we're seeing many more patients, in my view. So yeah, there's a risk. It can happen, but it's not near as common as what people think.
What kind of validity is there to that? I can't remember the exact name of it. It looks like you're laying upside down on like an ironing board. Like, is there
inversion table?
Yes. Is that something that is like a legitimate thing, or is it kind of one of those fads? Like, is there any scientific stuff behind that?
I'm not going to say I'm exactly sure off the top of my head the scientific literature, but I know that it can be helpful. And there's different levels of what's going on there, from an inversion table to a static traction machine to a decompression machine, where you're, harnessed in around your hips and around your ribs, and it stretches back, holds, and then down, hold, which is what I'm the biggest fan of. But all of those work to decompress a disc, which are the cushions between the vertebrae. And then after that takes pressure off the nerve. It can help. Yeah, it definitely can help. And there's varying levels to it. And you can get injured on it. If you hang upside down for too long, blood can rush to your head and people can pass out. So as with anything, there's an inherent risk with all of it, just like you can injure yourself in the gym, but that certainly can be one of those things that helps, just like a foam roller at home.
And as far as like just the everyday kind of person who goes to the gym, lifts some weights, are there any exercises, a lot of people talk about the deadlift, a lot of people, whatever, squatting. Is there anything that is, and I know it's inherent risk with everything, but like, is there anything that you see more of either causing harm to the back/neck or, really actually doing it really good, if done correctly?
Sure. So the deadlift and squat, great exercises for the legs, but when they're done to 1 rep max, that's when you see injuries happen. And if you're looking to compete at a high level, then I understand that's got to be part of it. And usually, though, those people have spotters and their technique is just pristine. Outside of that, though, if you're not looking to compete, I would recommend not going to those low rep maxes. Outside of that, I think that, again, those are great exercises. Something I think that can be really helpful for posture is extension. So just on those ab machines or those ab racks where you can hook your feet in at the bottom and lay face down and then kind of pop up. I think that's going to work the paraspinal muscles, the muscles on both sides of the spine, the back strap of a deer, essentially, if you're a hunter. And it's going to help with posture big time, which, there'll be a whole cascade of effects from improved breathing to improved circulation. So that's a good, easy one.
Yeah. And actually the breathing aspect is something that, reading a few books and listening to a few different things on that, it seems like we have this almost unnatural way of breathing. And it makes me wonder, like, how much of that does go back to the neck and the spine. Like, is that anything, like, do people come to you with that, or is that just maybe like a side benefit of what you're talking about?
I think that's honestly becomes a side benefit. People usually come in the door for pain. That's usually what, pain moves people. There are some people, though, that are aware of the benefits of chiropractic and the other holistic healthcare things, from, acupuncture we also do at the office. And so they come before they're in pain and they're looking to optimize their body. And so I've heard the breathing thing on a front end, but it's honestly, it's more rare. But yeah, you're right. It can't, because so you have different sections of the spine, the neck, the mid back, the low back, cervical, thoracic, lumbar. And corresponding to that, you have the parasympathetic and the sympathetic nervous system. So that's feed and breed and fight or flight. So, and those two different nervous, being activated can affect the breathing, from messing with the rhythm to shallow breathing to deep breathing. So that's one of the things that kind of gets balanced out.
Yeah. And with that kind of fight or flight, being so obviously tied directly in, the nervous system being tied in with the spine and stuff, is there anything out there, talking about potential of the posture, people sitting in class or sitting at a job and affecting their, their fight or flight and causing more anxiety? Like, is there any tie-ins between like the spine and mental health as well?
That's a great point. And there are. And so when we do get that irregular breathing and that shallow breathing, that can trigger anxiety. And that type of breathing itself can be caused from poor posture. I always, during a report of findings, if the person has a forward head posture, I ask them to accentuate. I say, so turtle your head forward as far as you can, and then take a deep breath and try it. Go ahead and try it with me. Turtle your head forward and try and take a deep breath.
Yeah, and then forces it back.
Yeah. Then pull your head back like Superman posture, perfect posture, and deep breath in. You can literally feel yourself take a deeper breath. So there's an actual function when the pressure's on the nerve from your head being forward. There's a functional change there. So yes, there is a tie.
That's interesting. And it just seems like, you talked about at the beginning, but this holistic idea, how everything is, so connected. And I mean, you obviously learn a ton from education. You learn probably, continuing education, things like that. But what do you think has been like the biggest thing that you've learned that you didn't get from, that you got from a real life experience that has just been something that has almost changed the way that you do your job?
Kind of like I was telling you, I've had some of my own boo-boos over the years, and being a patient, being in that position, I've been around a number of just amazing doctors, as well as those that weren't so great, and that's clinically also, clinically and from a bedside manner standpoint. And I think seeing that made a big impression on me, on my attention to the patient, and really listening to the patient to get a clear, full idea of what's going on and where they're coming from. And that allows me to help them to the best of my ability. And as a patient, or when I was a patient, I really learned that. So I think that was something I really took away.
Yeah. What are some of the biggest like misconceptions? You probably see a lot of people, and even just on the street, people that know that you're a chiropractor, and your family, friends, they probably have a lot of questions and stuff. But what are some of those biggest, like, oh, wow, I thought it was this kind of misconceptions about kind of how you do your job and what is important and what is not really has anything to do with chiropractic?
I guess there's some, I guess surface misconceptions with chiropractic, like the pop, the noise. There's no actually bones popping. It's nitrogen air bubbles being released from a joint that's locked up. And when we get that joint moving properly, that's the noise we get, the cavitation. But so that's one. Once I go, I got to go every week for the rest of my life. Well, that's not really the case either. Every case is different, and the frequency is going to be different. Now, is it wise to continue to go? Well, it's wise to continue to go to a dentist for the rest of your life to check in to make sure everything's okay. So I would say it's similar in nature there. I think one of the other things is we're so used to going to the doctor, getting something done, whether it's sewed up or cut out or a medicine, that the healthcare essentially is very passive. And when you come to see a chiropractor, you're going to be educated on ways to get healthy on your own, and not on your own, but take control of it. And it's not something usually that you're just better with one adjustment. Just like you're usually not to all your fitness goals after one time in the gym. It's a cumulative effect. And so that's another thing that people, or misconception, I think, of the whole approach.
How do you kind of go about helping someone not keep harming themselves in a way?
Well, I'm a big believer in all little things, and I think you got to take small steps with people. So it's sometimes it's kind of like a drop of water on the forehead, where I can just give little bits of inspiration, of little tips and tricks of ways you can be healthy, little reminders. Because I think, kindly, respectfully helping people see, okay, if I do this one little thing different, or this one thing I'm doing over here is hurting myself, that bringing awareness to it is one of the first steps to change. Just like anything else, culturally or any other way. So being conscious of the wallet in the back pocket, taking that out when you go to sit down so that your hips are level. Little things like that make big difference in your daily pain levels and function levels. So I try to go each time a little small tip or trick that I know will make a big difference, like that, or a reminder on hydration. So things like that. That's kind of how I am trying to slowly, get that into their head, that you do the little things, the basic things, and it's going to tremendously just give you the best chance to be as healthy and as in little pain as possible.
What about shoes though? Is there any big no-nos, or is there a big like push for a certain type of footwear, like anything like that?
I think you got to be conscious of what it's for. So if it's your work shoe, that's got to be, different than your gym shoe. And this could be a long conversation. I've done some extensive work with extremity adjusting as well as orthotics. I have orthotics sitting on my desk right now of just different custom orthotics. So that could be a really long and nerdy or fun conversation. But either way, I think you got to be aware of what the shoe is for. And then when you look at your shoes, the bottoms of the shoes, when they get worn out, you know, if one side is worn out more than another, that's showing you, A, your foot's not striking the ground evenly. And if one of your four tires isn't as even on the ground as the other, it's going to wear out quicker. Same with your spine. So that's something to trigger. Maybe you're not having pain, but maybe you need to look to get leveled out. And also people, I think, hold on to their shoes too long, especially guys. So you got to cycle through and get a new pair of shoes when they get worn down. And that's one of, again, a little thing. And besides that, girls, they wear cute shoes too often, and it doesn't give them great support. And that can do a real number on their foot pain, as well as going up the kinetic chain, so knees and hips. So those slip-ons are cute, but they're not great for the feet.
Is there anything like yoga or like Wim Hof, anything like that that you see like specifically or recommend that can be a kind of like a practice that's not necessarily lifting weights or anything like that you recommend a lot?
Yeah, Wim Hof is great. Tony Robbins has a whole breathing priming that he does that you could just YouTube. That's really actually great as well. I'm a big believer in yoga, big believer in meditation. I do both meditation every day and yoga probably 2 to 3 days a week. So I think those are really important. Again, yoga can really help with the flexibility and loosening up joints in a very healthy and safe way, as well as teaching those deep breathing techniques. So yeah, big believer in all of that.
Anything we haven't mentioned so far that you just want people listening to just be more aware of, be more thoughtful of, whatever it is, just to be more comfortable and reduce that pain or stop pain from occurring?
Sure. I think, especially probably your audience, a big part of your audience at being gym goers, is already conscious of their health, and they're doing the gym thing. And I love that. Many times we have to, and therefore they know about pain, and we have to fight through pain. But there is a difference in pain and an injury. And if you are injured, that's something you got to get taken care of. And the sooner you can do that, the better chance you have of completely healing with minimal scar tissue. And at some point, the scar tissue does catch up to us. So I think, especially when it comes to the spine, if you're having spinal pain, that's a lot different than just a sore muscle that's going to loosen up and work out. So whether that's trying massage or chiropractic or acupuncture or acupressure, I think those all can be great and helpful.
Really appreciate you coming on. It's been really cool to get to talk to you, especially you being right here local. And if people want to come see you, or if they want to, even on Instagram, where can they do both of those things?
So Instagram, you can find me at Spine Ninja. The clinic I'm at, it's First Choice Health and Wellness. The number is 812-945-4500.